Hi everyone, I'm John, and today we're covering diabetes and blood sugar control, a condition that affects over 15 million Americans who age 60 and older. But let me tell you something most people don't realize. Type 2 diabetes is often preventable and even reversible in early stages. And to help you, I designed 20 questions that will teach you how to protect yourself, manage your blood sugar, and take back control. Ready? Here is the first question. What fasting blood sugar level indicates prediabetes? A. 70 to 99 milligrams per deciliter. B. 100 to 125 milligrams per deciliter. C. Above 200 milligrams per deciliter. The answer is B. 100 to 125 milligrams per deciliter. This is the warning zone where you can still turn things around. If your fasting glucose is in this range, lifestyle changes now can prevent progression to full diabetes. Don't ignore these numbers, they're your early alert system. Question 2. Which lifestyle change has the biggest impact on preventing type 2 diabetes? A. Taking vitamin supplements. B. Losing 5 to 7% of body weight. C. Drinking fruit juice daily. B is correct, losing 5 to 7% of body weight. For someone weighing 200 pounds, that's just 10 to 14 pounds. A major study called the Diabetes Prevention Program found this modest weight loss reduced diabetes risk by 58%. You don't need to become thin, just a little lighter makes a huge difference. Now, question 3. What is the A1C test and why does it matter? A test measuring cholesterol levels. B. A test showing average blood sugar over 2 to 3 months. C. A test for kidney function. The answer is B. A test showing average blood sugar over 2 to 3 months. Unlike daily glucose checks, the A1C gives the bigger picture. An A1C below 5.7 is normal. 5.7 to 6.4 indicates prediabetes, and 6.5 or higher means diabetes. Knowing your A1C helps you track real progress over time. Let me explain why this test is so valuable for managing your health. Daily blood sugar readings can vary wildly based on what you ate, stress levels, sleep, and even the time of day. The A1C measures how much glucose has attached to your red blood cells over their 3-month lifespan, giving you a true average. A study published in Diabetes Care found that for every 1% reduction in A1C, the risk of diabetes complications dropped by 21%. That means going from an A1C of 8 to 7 significantly protects your eyes, kidneys, nerves, and heart. Ask your doctor for this test at least twice a year if you have diabetes, or annually if you're at risk. Question 4 coming up. Which type of carbohydrates raises blood sugar most quickly? A. Whole grains like oatmeal. B. Refined carbs like white bread and sugary drinks. C. Vegetables like broccoli. B is correct. Refined carbs like white bread and sugary drinks. These are digested rapidly and spike your blood sugar fast. Whole grains and vegetables contain fiber that slows absorption, keeping your levels more stable. Swapping refined carbs for whole food alternatives is one of the easiest changes you can make. Let's keep moving. Question 5. How does walking after meals affect blood sugar? A. It has no effect. B. It helps lower blood sugar by using glucose for energy. C. It raises blood sugar dangerously. The answer is B. It helps lower blood sugar by using glucose for energy. Just 10 to 15 minutes of walking after eating can significantly reduce blood sugar spikes. Your muscles use glucose for fuel when you move, pulling it out of your bloodstream naturally. This simple habit after meals is one of the most effective tools you have. Question 6. Which organ produces insulin in your body? A. The liver. B. The pancreas. C. The kidneys. B is correct, the pancreas. This small organ behind your stomach produces insulin to help glucose enter your cells. In type 2 diabetes, either your pancreas doesn't produce enough insulin or your body doesn't use it effectively. Protecting your pancreas through healthy eating and maintaining a normal weight keeps it functioning longer.
For 6 questions, and how are you going so far? Keep track of your score and please share it with me in the comments when we're done.
Question 7. What is insulin resistance and can it be reversed? A. A permanent condition where insulin stops working. B. A condition where cells don't respond well to insulin, often reversible with lifestyle changes. C. An allergy to insulin medication. B is correct. A condition where cells don't respond well to insulin, often reversible with lifestyle changes. Insulin resistance is the first step toward type 2 diabetes, but it's not a life sentence. Weight loss, exercise, and dietary changes can restore your cells' sensitivity to insulin. Many people have reversed insulin resistance completely. Moving on to question 8. Which foods help stabilize blood sugar throughout the day? A. Foods high in protein, fiber, and healthy fats. B. Foods high in sugar and refined flour. C. Skipping meals entirely. A is correct. Foods high in protein, fiber, and healthy fats. These nutrients slow digestion and prevent rapid blood sugar spikes. Think eggs with vegetables for breakfast, salads with grilled chicken for lunch, and salmon with leafy greens for dinner. Balanced meals keep your energy steady and your blood sugar controlled. Building meals this way becomes second nature once you understand the principle. Protein from sources like fish, chicken, eggs, or legumes takes longer to digest than carbohydrates. Fiber from vegetables, whole grains, and beans slows down glucose absorption. Healthy fats from olive oil, avocados, and nuts further extend digestion time. A study from the American Journal of Clinical Nutrition found that adding protein and fat to a carbohydrate-heavy meal reduced blood sugar spikes by up to 40%. The practical application is simple: never eat carbohydrates alone. Pair that apple with almond butter, add chicken to your pasta. Include avocado with your toast. These combinations transform blood sugar control. Question 9. How does stress affect blood sugar levels? A. Stress lowers blood sugar. B. Stress raises blood sugar through hormone release. C. Stress has no effect on blood sugar. The answer is B. Stress raises blood sugar through hormone release. When you're stressed, your body releases cortisol and adrenaline, which trigger glucose release for quick energy. Chronic stress keeps blood sugar elevated even if you're eating well. Managing stress through relaxation, hobbies, or breathing exercises directly supports blood sugar control. Question 10. We're halfway there. Now answer this. Can type 2 diabetes actually be reversed? A. Never. It's always permanent. B. Yes, especially in early stages through significant lifestyle changes. C. Only with surgery. B is correct. Yes, especially in early stages through significant lifestyle changes. Research shows that people who lose weight, change their diet, and exercise regularly can sometimes achieve normal blood sugar levels without medication. The earlier you intervene, the better your chances. Remission is possible for many people. Question 11. Which drink is surprisingly harmful for blood sugar control? A. Black coffee. B. Fruit juice. C. Sparkling water. B is correct. Fruit juice. Many people think juice is healthy because it comes from fruit, but it's concentrated sugar without the fiber. One glass of orange juice can contain as much sugar as a can of soda and spikes blood sugar just as quickly. Eat whole fruit instead. The fiber makes all the difference. Question 12. How does sleep affect blood sugar and diabetes risk? A. Sleep has no connection to blood sugar. B. Poor sleep increases insulin resistance and hunger hormones. C. Sleeping less than 5 hours improves metabolism. B is correct. Poor sleep increases insulin resistance and hunger hormones. Just one night of poor sleep can make your cells more resistant to insulin the next day. Chronic sleep deprivation also increases cravings for sugary, high-carb foods. Prioritizing 7 to 8 hours of quality sleep is a powerful diabetes prevention strategy. The connection between sleep and blood sugar is stronger than most people realize. Research from the University of Chicago found that cutting sleep to 4 hours per night for just 1 week reduced insulin sensitivity by 30% in healthy young adults. That's enough to push someone from normal blood sugar into pre-diabetic range. Sleep deprivation also increases ghrelin, the hunger hormone, while decreasing leptin, the fullness hormone. This combination drives cravings for exactly the foods that spike blood sugar. A study in diabetes care showed that people who improved their sleep from less than 6 hours to 7 to 8 hours saw significant improvements in A1C levels. Treating sleep as seriously as diet and exercise transforms your metabolic health. Question 13. What is the glycemic index and how does it help? A. A measure of how much protein foods contain. B. A ranking of how quickly foods raise blood sugar. C. A measure of calorie content. The answer is B. A ranking of how quickly foods raise blood sugar. Low glycemic foods like vegetables, legumes, and whole grains raise blood sugar slowly and gently. High glycemic foods like white rice, white bread, and sugary snacks cause rapid spikes. Choosing more low glycemic foods helps keep your blood sugar stable throughout the day. Question 14 now. How much does regular exercise reduce the risk of type 2 diabetes? A. About 5%. B. About 30 to 50%. C. Exercise has no proven effect. B is correct, about 30 to 50%. Regular physical activity makes your cells more sensitive to insulin, helps with weight management, and lowers blood sugar directly. Both aerobic exercise like walking and resistance training like light weights provide benefits. Aim for at least 150 minutes per week. That's just over 20 minutes a day. Question 15. Which symptom often appears first in undiagnosed diabetes? A. Sudden weight gain. B. Increased thirst and frequent urination. C. Improved energy levels. B is the answer, increased thirst and frequent urination. When blood sugar is high, your kidneys work overtime to filter excess glucose, producing more urine. This makes you dehydrated and thirsty. If you're constantly thirsty and running to the bathroom, especially at night, talk to your doctor about checking your blood sugar. Let's continue. Question 16. What role does fiber play in blood sugar management? A. Fiber spikes blood sugar rapidly. B. Fiber slows glucose absorption and improves blood sugar control. C. Fiber has no effect on blood sugar. B is correct. Fiber slows glucose absorption and improves blood sugar control. Soluble fiber in foods like oats, beans, and apples forms a gel that slows digestion. This prevents the rapid blood sugar spikes that stress your pancreas. Aim for 25 to 30 grams of fiber daily through vegetables, fruits, legumes, and whole grains. Question 17. How does apple cider vinegar affect blood sugar? A. It has no effect. B. Small amounts before meals may help reduce blood sugar spikes. C. It cures diabetes completely. is correct. Small amounts before meals may help reduce blood sugar spikes. Research suggests that 1 to 2 tablespoons of apple cider vinegar diluted in water before meals can modestly improve insulin sensitivity and reduce post-meal blood sugar spikes. It's not a cure, but it's a simple tool to add to your routine. The research on apple cider vinegar is more promising than many people expect. A study published in Diabetes Care found that participants who consumed apple cider vinegar before a high-carb meal had 34% lower blood sugar levels afterward compared to those who didn't. Another study in the Journal of Functional Foods showed improved A1C levels in people with type 2 diabetes who consumed vinegar daily for 12 weeks. The acetic acid in vinegar appears to slow stomach emptying and improve insulin sensitivity. The key is diluting it well, about 1 to 2 tablespoons in a full glass of water, and drinking it before meals rather than after. It's not a replacement for medication or lifestyle changes, but it's an inexpensive addition that may help. Question 18. Which cooking method helps keep blood sugar more stable? A. Deep frying everything. B. Grilling, baking, or steaming instead of frying. C. Adding sugar to all recipes. B is correct. Grilling, baking, or steaming instead of frying. Fried foods often have breading that adds carbohydrates and unhealthy fats that promote insulin resistance. Grilling, baking, steaming, or sautéing in olive oil preserves nutrients without adding blood sugar spiking ingredients. How you cook matters as much as what you cook. Almost done. Question 19. What should you do if you're diagnosed with pre-diabetes? A. Wait until it becomes diabetes to take action. B. Start lifestyle changes immediately since reversal is possible. C. Assume nothing can be done. The answer is B. Start lifestyle changes immediately since reversal is possible. Prediabetes is your body giving you a warning and a chance. Studies show that 5 to 10% weight loss combined with 150 minutes of weekly exercise can reduce progression to diabetes by over 50%. Many people return to normal blood sugar levels with dedicated effort. Don't wait, act now. Last question. What is the most empowering truth about type 2 diabetes? A. It's entirely genetic and uncontrollable. B. Your daily choices have enormous power over your blood sugar and outcomes. C. Only medication makes any difference. B is the correct answer. Your daily choices have enormous power over your blood sugar and outcomes. While genetics play a role, lifestyle factors are often more important. Every meal, every walk, every good night of sleep contributes to better blood sugar control. You have more influence over this condition than almost any other. Take that power seriously.
These were all 20 questions on diabetes and blood sugar. If this quiz gave you useful information, hit subscribe and leave a like.